Dr. Taweel, our go-to doc on all issues COVID-19. Methanol in the hand sanitizer, Doc, is that a bad thing?
Yes, it's a bad thing. Methanol is something that's commonly found in antifreeze and a lot of chemical solvents and things like that that have multiple warning labels all over them to make sure that you're not getting toxic levels of it. So it definitely should not be a common product in hand sanitizers.
Do you have any idea how did that happen? How did it end up in there in the first place?
I don't know. I think what happened is, from what I'm reading, the FDA had pretty much banned a lot of ones coming out of Mexico. So they may have less strict guidelines with regards to what their ingredients are in their common products. I'm not sure, and certainly don't quote me on that. But if these ones that are coming out of Mexico have methanol, it might just be a filler, might be corporations trying to save money in an effort to try and create a particular type of sensation or a particular type of smell to give the impression that the hand sanitizer is working more effectively. That might be what has happened.
So going to the Civic Center TV website, you'll find a link to Channel 4. Click on Detroit's article, and they list the sanitizers that have methanol in them. All Clean hand sanitizer, ESK Biochem, Clean Care, Lavar or Laver 70 gel, Good Gel antibacteria, Clean Care, Clean Claire, and Sandiderm Advanced Hand Sanitizer. Maybe what you should do is get the hand sanitizer, Doc, from the local breweries that pivoted. A lot of not the breweries, the distilleries, because a lot of the distilleries around here stopped making vodka and started making hand sanitizer. And yeah. I bet they didn't put any methanol in there.
No, I would wonder how they would even get a hold of some of that. It's not good to have. Methanol can cause some pretty significant irritation to the hands if applied to the skin. Poison from methanol is rare. When absorbed into the skin, it can happen, but it's pretty rare. You really actually have to drink it in order for it to become problematic.
All right, we're going to talk about that too, so keep that on your mind for a minute. But if you have indeed been exposed to hand sanitizer, and you go online and you check the list, and, well, I got some of that, what kind of treatment should you seek out if you've been using one of the bad sanitizers?
You should seek out treatment well, first and foremost, contact your doctor. Do not delay on anything like that. And when methanol, the problem with methanol is when you have it in your system, it's actually the methanol itself that's not really the issue. The issue is what your body does once it receives the methanol. It actually converts it to a more dangerous more dangerous chemical that then causes toxic effects to your body. So what happens is that timing is very important, because if you ingest this accidentally for whatever reason and you start to have symptoms, the sooner you get ahead of it, they can administer drugs that will actually prevent your body from converting it to that poisonous metabolite, and hopefully can give you some benefit. Once you have it in your system to such a degree, reversing it becomes significantly more difficult. And it's also a problem because the story is an important thing. Most of the time, testing to determine levels of methanol in your system takes so far and so long to come back that emergency rooms don't even bother doing it, unless they have a significant reason to believe that's the case. But the turnaround time on these very complex labs, unfortunately, aren't fast enough to get in the way of treatment. So oftentimes they just go straight to treatment. Things such as my mind is blanking, but things such as dialysis are ultimately what ends up trying with this. That's the point I was trying.
And we can get from just putting hand sanitizers on our hands, the methanol would just leach through our skin and get into our bloodstream. We wouldn't have to digest it directly by drinking it or something, right?
True, but oftentimes, like I said, it's difficult to get toxic levels to the point where it can cause significant issues. Like, in other words, significant toxic levels of metabolites. Difficult to do when absorbed through the skin, not impossible. But in terms of orally ingesting it, as little as a teaspoon can cause significant, if not fatal reactions, if not treated appropriately.
All right, so there are a bunch of brands made by ESK Biochem, or ESK Biochem, rather, SA de CV in Mexico. No, don't drink their water, and don't use their hand sanitizer out of Mexico. I'm making a joke out of it, but... Huh?
And then most importantly, don't drink their hand sanitizer.
Yeah, well, let's talk about that. So I heard another report, maybe it's somebody reporting the same story. I heard another report in the media today talking about that. And, severe alcoholics will consume anything with alcohol in them, and it's so sad. But we know the history of folks consuming mouthwash and other things. I guess some people have thought about consuming alcohol-based hand sanitizers. As rare as that might be, it's a terrible idea. Correct, Doc?
Absolutely a terrible idea. And, consider this: it's not that rare to any average hospital physician who sees patients that go in there frequently. People that have significant issues with alcohol dependence have been found to drink the alcohol hand sanitizers that are in hospital rooms to try and to get some alcohol in their system, and that is when it becomes awfully dangerous. So, yeah, definitely not recommended to consume anything that is not meant to be consumed. That's where you get into severe trouble.
Okay, anything else you want to share with us today?
No, I appreciate you having me on as always. Thank you so much.
Well, no. We called you at the last moment, and thank you for helping us sort this out. We wanted to make sure we were sharing the correct information. You're not even going to tell me to, wash my hands or go on a diet or anything doctors always tell me when I talk to them?
Well, of course. Wash your hands, go on a diet, maintain social distancing. Please wear face masks. We're not out of the woods with COVID yet, but we're doing
We are not. All right. Thank you, Doc. Appreciate it. Dr. Taweel joining us here again on the MegaCast.